So the purpose of our study was to try to identify the incidence of thoracic aortic aneurysmal disease, since the epidemiology of this is not well described in the literature or in any recent series. Hi, my name is Randall DiMartino, and I am a vascular surgeon at Mayo Clinic in Rochester, Minnesota. And I am happy to provide a summary of our manuscript published in Mayo Clinic Proceedings. It's titled A Population-Based Incidence and Natural History of Degenerative Thoracic Aortic Aneurysms. Our center actually has reported this epidemiological data back from the 1980s up until 1995, but all of those data are now more than 2 decades old, and we wish to provide a more contemporary summary of the epidemiology of thoracic aortic aneurysm disease. We're fortunate in Minnesota and in Olmsted County to have the Rochester Epidemiology Project, which helps to catalog all patient interactions and diagnoses and procedures done with residents of Olmsted County. And using that, we were able to screen over 2,500 patients for thoracic aortic aneurysms and review thousands of imaging studies for these patients to confirm which had thoracic aortic aneurysm disease of either the ascending aorta, descending aorta, or both. And upon doing that, we were able to identify 238 patients who were Olmsted County residents, about half of which were women who had thoracic aortic aneurysm disease. As was noted in other studies, about 65% of these patients had aneurysms involving the ascending aorta, and the remaining had those involving the descending aorta. Involving the epidemiological data of thoracic aortic aneurysm disease, we found a incidence rate of 13.8 per 100,000 person years. And this varied slightly during the study period, but overall there was no significant trend. We had a low incidence of 9.9 per 100,000 person years in 1995 to 1999. There was a higher rate between 2005 to 2009 at 19 per 100,000 person years, but then that subsequently came down. And so overall, there was no major trend among this. When we separated them out by ascending and descending aortic aneurysms, they were higher at 9 per 100,000 person years for ascending aortic aneurysms and 4.9 for descending thoracic aortic aneurysms. Of note then, once we had our epidemiological cohorts established, we could look at the natural history of these patients, and it was worthy to note that overall these patients have a lower survival than the expected population of Minnesota. And within the groups, looking at those with either ascending aneurysms or descending aneurysms, descending aortic aneurysms had much lower survival compared to ascending aortic aneurysms at about 2.5 times the rate of death. And these were related to patients with advanced age, advanced smoking, as predominant risk factors for lower survival over time. Important as well in our findings were that approximately 15% of patients suffered an aortic-related event, even though they had a known aneurysm, and 30% had a cardiovascular-related death. So the important implications of our findings are that the incidence is fairly stable for thoracic aortic aneurysm disease, and this runs counter to what we know about other cardiovascular diseases, such as the incidence of myocardial infarction within Olmsted County, as well as national data about the incidence of abdominal aortic aneurysms, which have shown a decline, which is correlated with a decrease in smoking rate. So we see a fairly stable rate of the thoracic aortic aneurysm disease, which causes us to have to evaluate better ways to try to reduce the incidence of the disease, and other factors besides most cardiovascular risk factors may need to be addressed. Additionally, there's other factors that go into thoracic aortic disease that are less common in the abdominal aorta for us to focus on. The findings in practice, I think, generally relate to the fact that patients with identified aneurysms still have high rates of cardiovascular and aortic-related events, So the practitioner who identifies patients needs to have rigorous follow-up for their thoracic aortic aneurysms, and managing cardiovascular risk factors becomes critical because nearly a third of these patients will have a death related to a cardiovascular cause. As far as patients, I think they need to be counseled about what the implications are for thoracic aortic aneurysm, what they can expect in terms of medical management early, treatment of risk factors, as well as surveillance, and when it's indicated for them to have a surgery to try to prevent an aortic-related event, and to make sure they have diligent follow-up for all these things to try to get the best outcomes. Next step in our research really needs to understand which patients may be at higher risk for aortic-related mortalities and cardiovascular-related mortalities. Once these pathologies are identified, then this presents an opportunity for us to intervene to optimize the patient and do so in a way that can improve their long-term outcomes. Here at Mayo Clinic in Rochester, patients are seen within our aortic center and have a multidisciplinary evaluation with cardiology, cardiovascular surgery, genetics when needed, and vascular surgery. This helps bring a holistic approach to managing multiple aspects of the patient's care and identifying when decisions need to be made regarding surgical intervention and medical management therapies. I invite you to read the article and hope that is helpful in treating patients with thoracic aortic disease, and I appreciate your interest. Thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.